SPO is the best.
All right, boom, let's lock in. So if I was to freeze frame an athlete mid-movement, right? Imagine they were doing something like a squat, a football kick, a push-up or something like that. By the end of this video, you should be able to say with confidence what joint is moving, what type of joint is it, which bones are articulating that joint, which plane and axis is the movement happening, what is the joint action called, which muscle is the agonist, which muscle is the antagonist, and what type of contraction is happening. So that is what we are going to look at in this video. Let's start with planes and axes. So planes show the direction that movement travels in, and axes are imaginary lines that the body rotates around. These are the planes and axes you need to know, and it makes more sense to learn them in pairs. So the pairs you need to know are the sagittal plane and the transverse axis, the frontal plane and the sagittal axis, the transverse plane and the longitudinal axis. And with each of these planes and axes, you notice that the axis is always going through the plane. So the sagittal axis is going through the frontal plane, the longitudinal axis is going through the transverse plane, and the transverse axis is going through the sagittal plane. Before we look at the different movements that happen at these different planes and axes, it's important you know what the movements actually mean. So these are the definitions of the movements you need to know. These are the type of movements that happen at the sagittal plane about the transverse axis. Some sporting examples of movements that happen at the sagittal plane around the transverse axis are things like a bicep curl, or the push phase of a push-up or a bench press, or the lowering phase of a squat, or standing up phase of a squat, or the striking phase of a kick, or lifting the foot upwards towards your shin, or doing calf raises, and many more exercises that incorporate these movements on the screen. These are the movements that happen at the frontal plane about the sagittal axis. And sporting examples of movements that happen at the frontal plane about the sagittal axis are any movement that incorporates side-to-side movements. So side shuffling, side stepping, anything like that. Next, let's look at the movements that happen at the transverse plane about the longitudinal axis. So some sporting examples could be something like the push phase of a chest pass or a bench press, or even the lowering phase of a bench press, or the pullback over your head before a throw-in in football. Those are all sporting examples that happen at the transverse plane and the longitudinal axis. Joint types and articulating bones. These are the two joint types you're going to use constantly in this course. Hinge joint and ball and socket joint. Hinge joints mainly allow flexion and extension. Ball and socket joints allow multi-axial movement, which means they allow pretty much every type of movement. Now you know the joints. Whenever you want to talk about the articulating bones just means the bones that are around the joint. These are the bones you want to talk about. So at the shoulder, the articulating bones at the shoulder are the scapula and the humerus. Another name for the scapula, glenoid. So the scapula and the humerus are the articulating bones at the shoulder. At the hip, which is a ball and socket joint as well, the articulating bones there are the pelvis, aka the acetabulum, and the femur. At the elbow, which is a hinge joint, the articulating bones are the humerus, the radius, and the ulna. At the knee, which is also a hinge joint, the articulating bones are the femur and the tibia. Don't forget the patella sits in front as well. Patella is this little bone at the front of your knee. It's your kneecap basically. And lastly, at the ankle, which is a hinge joint, the articulating bones here are the tibia, fibula, and the talus. Now we've talked about planes and axes and joints and bones. Let's talk about muscles. Let's talk about the different roles of muscles when you are lifting something or moving or taking part in any action. So we have the agonist and the antagonist. These are two different roles that muscles take. The agonist is the muscle which is the prime mover. So the agonist is the muscle that is mainly responsible for producing the movement, and the antagonist is the muscle that opposes the agonist's action. Very, very, very simple example. During a bicep curl, when you are raising that weight, the agonist is your biceps because they are contracting to help you pull that weight up. And the antagonist are your triceps because they are relaxing to allow your biceps to work. They are, in effect, opposing the action of your biceps to allow the movement to happen. Now, let's look at the different types of contractions that you need to know. There are two broad categories of contractions. There are isotonic contractions and isometric contractions. Isotonic meaning that the muscle changes length under tension, and isometric meaning the muscle is producing force without changing length. Now, under isotonic, we have two types. We have concentric and eccentric. Concentric contractions happen where the muscle shortens. Eccentric contractions happens where the muscle lengthens. Let's analyze this in the context of an example to make it easier to understand. So let's say we are doing squats. We're going up and down. Let's start with the lowering phase. You are lowering the weight during a barbell squat, for example, right? There is an isotonic eccentric contraction happening at the hamstrings during the lowering phase because your hamstrings are lengthening while under tension. Now, let's say you've gone all the way down, you're about to come all the way up. Coming up, there is an isotonic concentric contraction at the quadriceps because your quadriceps are shortening to be able to create knee extension so you can stand back up. Now, an example of an isometric contraction could be if you are just holding a squat in one position. So like a wall sit, for example, just holding it in one position. Your quadriceps and your hamstrings are both contracting, but they are not changing length. Okay, now this is what it has all come down to. Your success in this topic depends on your ability to be able to successfully apply movement analysis. And this is a 6-step method to make sure that you are always getting full marks. So whenever you're analyzing a movement, you want to talk about the joint type, articulating bones, axes, plane, action name, the agonist and antagonist muscles, and whether it's a concentric, eccentric, and isometric contraction. Let's look at some quick examples. Let's say a bicep curl, right? This is where you are undergoing elbow flexion in the upward phase or elbow extension in the downward phase. The upward phase, when you're lifting it, the joint type is obviously your elbow joint, which is a hinge joint. The bones are the humerus, radius, and ulna, which are articulating that elbow hinge joint. The plane and axis is the sagittal plane and transverse axis. The action is elbow flexion, and the muscles are the biceps, which are the agonist, the triceps, which are the antagonist, and during the upward phase, the biceps are undergoing a concentric contraction. And during the lowering phase, it's a similar joint action, but in the opposite direction because now extension is happening. So let's go through our 6-step method to analyze this. The joint and the joint type stays the same. Elbow joint, which is a hinge joint, articulating bones stay the same. The radius, ulna, humerus. Plane and axis, again, stays the same. Sagittal plane, transverse axis. The action this time is different, so it's extension, elbow extension. And then again, we have the biceps working as the agonist still, and the triceps still working as the antagonist. But the only difference here is that the biceps are now contracting eccentrically to lower the weight. Let's use another example. Let's talk about squatting, right? We can analyze squatting. Squatting is a good one because it can be analyzed at the hip or the knee. Let's analyze it at the hip. Okay, so at the hip, it's a ball and socket joint. The hip joint, ball and socket joint, the articulating bones are the pelvis and the femur. Plane and axis, same as with the bicep curl. Sagittal plane, transverse axis. Now we're talking about the lowering phase here. So the lowering phase of a squat, the movement, the action at the hip is hip flexion. The agonist muscles are the quadriceps and the gluteal muscles, and the antagonist muscles and the quadriceps and gluteals, the agonists are actually contracting eccentrically to lower you down. Now, what happens when we are standing back up is that same thing again at the hip joint, which is a bone and socket joint, articulating bones, pelvis, and the femur. Again, sagittal plane, transverse axis. The action name this time is hip extension because we are going up. The main agonists, again, gluteals and the quadriceps, with the antagonist being the hamstrings. But this time, they are contracting concentrically to move you upwards. Those are two examples for you. If you want to do more practice questions, you want to study this topic a bit more and master it, especially with this 6-step method, which I highly recommend, then feel free to check out superpeonline.com, our platform, the best PE revision platform in the world. Yep, I said it. Check it out for a bunch of revision materials, practice papers that will help you level up and get the best grades possible. See you in the next video.